Hello again, my name's D. Campbell and welcome to one of my quick video on demand training videos. Today's video we're going to be talking about needle stick coding. What I mean by that is how do you code an incident when a provider ends up getting a needle stick. These visits can have common denials because they'll usually go to workers' comp, and workers' comp can be a little bit annoying to deal with, to be honest with you. So let's talk about how these should be coded to make certain you don't deal with denials. The two big guidelines that we have to talk about for this one is just purely 21C.1, the contact and exposure guideline, versus the screening guideline, because this is going to be the one that causes you the denials. The issue is people will tend to want to use the screening codes on all of the labs, but as we'll look through this, screening codes are not actually the proper codes to use in these circumstances, since screening is for testing for disease precursors in seemingly well individuals where there's no necessary reason for testing it. Screening codes are used for when a patient is due for a screening based on like the United States Preventative Task Force schedule. I have a very long video about screening guidelines. Please check that one out. Well, contact and exposure is what we're going to use in these cases because the guideline reads category Z20 indicates contact with and suspected. We're going to use that suspected word pretty heavily in these circumstances. Suspected exposure to communicable diseases. These codes are for patients who are suspected to have been exposed to a disease by close personal contact with an infected individual. Then there's also category Z77, that's a part of these same guidelines, where it's other contact with suspected exposures to hazardous health indicated to contact with and suspected exposure to hazardous health. And then finally, there's this carve out here that will cause denials that I want to point out, where it says contact/exposure codes must be used as the first listed code to explain an encounter for testing, or more commonly as a secondary code to identify potential threats. So in this case, this is when you will use it as a first listed diagnosis because it is why the patient is coming in. They're coming in for the testing. So let's break down how a visit can look at the end and how the final codes will look. Let's say we have a patient presents, this is the documentation, patient presents to clinic after they accidentally stuck themselves in right index finger with needle after injecting patient. HIV, Hep B, and Hepatitis C labs were ordered. We will get denied if you just bill it with these two codes here. Since these codes are considered external cause codes, they don't tell enough of the story. So if you do it with only these codes, you will get denied. So let's say you know that you want to use the Z77 as the first listed for contact with and suspected exposure to hazardous body fluids. That's what we're using for when you get stuck with a needle that has already been in another patient. There's a risk to hazardous exposure. We will then list second the puncture injury code to the best finger possible. And then let's say the coder ends up using Z11s instead on the labs. These are your screening codes for the HIV and for other viral. These ones are likely to get denied because these are screening codes when truly we're ordering for exposure. Well, at the bottom here, I have two other examples where this is the acceptable version, where it's all these codes here, except we're missing the external cause codes. Technically, yes, you will get paid with this. This is the right way to code for it, and then you will get coverage. But if you do want to code to the highest level possible, which is always my recommendation, you would code it like this here on the bottom. Just make certain you're using the Z71 as the first listed for the exposure to the hazardous bodily fluids. Then we're going to use the puncture injury. And finally, we're using the most specific Z20s for the labs that were done. The suspected exposure to HIV and suspected exposure to hepatitis. And that's how we will code these to make certain we get coverage for it. And that's basically it. That's needle sticks for you. Just make certain you're avoiding these two conflicting guidelines. If you report a contact with a screening code, your likelihood of being denied is pretty high just due to how these guidelines are written. So instead, I would recommend you code it like at the bottom. And that's it. My name's D. Campbell, and that's how you get coverage on your needle sticks. Bye.